Thank you for joining us at the Evolution of Medicine Summit. A warm welcome. We wanted to make a specific thank you to our sponsors that have made this event possible. Energetics, an innovative natural remedy and supplement company, is committed to revitalizing medicine, and Cyrex Labs, a clinical immunology laboratory specializing in functional immunology and autoimmunity. Most of all, thank you for listening. If you'd like to share this with your colleagues and friends on Facebook if you enjoy the content, and if you have questions, you can ask us on Twitter with the hashtag EvoMed. Finally, if you really want to play your part in accelerating the evolution of medicine, ask your doctor if the Evolution of Medicine Summit might be right for them. Thank you and enjoy. Hello and welcome back to the Evolution of Medicine Summit. I'm your host, James Maskell, and we have a very special treat for the summit here today. We've been mainly talking about preventative approaches to health, and I thought one of the most interesting developments in America is that there's this whole other industry, very powerful industry that's right in line with the goals of the preventative medicine industry, and that is Silicon Valley and the burgeoning digital health world. And so I have here as an expert to talk about that, Stephanie Tilenius. Stephanie has an MBA from Harvard, as well as previously working at Google and eBay. She's co-founder of PlanetRx.com and is now executive in residence at Kleiner Perkins, Caulfield and Byers, which is one of the most prestigious VC companies in the Valley. So a perfect person to have come and speak. Thank you so much for being here, Stephanie, and being part of the Evolution of Medicine Summit.
Wonderful to be here. Good morning.
So, I first heard about your work last year when you wrote a great article for Forbes called "Will an app a day keep the doctor away?" And so I know that you've moved from roles that don't really involve medicine at all to, this new role where you're really entrenched in the sort of the digital health world. What is it that gets you excited about this world, and why have you chosen to spend so much time now in this world?
Well, I think that this is a ripe time in the next decade or 2 decades. The practice of medicine and healthcare as we know it is fundamentally going to be transformed. And the timing is really driven by the evolution of technology, but also mobile and social and cultural dynamics as well. And, in many ways, the PC revolution, the internet revolution didn't really change medicine enough. And now with mobile and cloud, I think you're going to see a transformation that is going to leave us not recognizing the current system in probably 20 years. It'll be completely different.
Well, that's really exciting. I know in Silicon Valley, entrepreneurs like to look at over-bloated industries to try and disrupt, and it seems like medicine is almost like the ultimate bloated industry.
Well, yeah, there's a lot of inefficiency,
Yeah.
to say the least, and we spend quite a bit on it, and it's nearly 20% of our GDP. So, and it's something that really matters to everyone. Everyone cares about their health.
Yeah, exactly. So for people out there, there's a lot of doctors, there's a lot of patients listening to this. Could you sort of maybe paint a picture of how you see technology playing a role in solving this current medical crisis, or at least innovating on this medical crisis, and some of the things that you see moving forward?
Well, I think technology will impact nearly every area of medicine and medical research. So imagine the way that we diagnose patients, monitor patients, provide care, even write a prescription, will change. It'll become much more virtual and continuous and preventative and personalized through the use of technology and mobile. And then even research, and there'll be more of an approach of collaboration in the cloud between scientists. So whether it's diagnosis or treatment or research, or even frankly, my hope is that even pricing and billing of relative services will become much more of a transparent marketplace shopping experience, much like any other industry. So I think technology has the potential to impact nearly every aspect of medicine and healthcare.
You've mentioned before, and this is something that's come up before, is sort of the desire to turn the healthcare consumer into a CEO of their own health. And certainly, empowerment medicine is something that's been a real theme throughout the Evolution of Medicine Summit. How do you think technology specifically helps to empower people to sort of really take central responsibility, or what will happen through that?
Well, you're already seeing today that the growth of wearables and the prediction is that there will be 150 million wearables by 2017. And so with a wearable, even just having basic knowledge and awareness and mindfulness of your blood sugar or your, glucose level, obviously your glucose level or your heart rate or your heart rate variability or things going on in your body will create better behavior, I believe, on the part of humans. And you're going to see a transformation where you have wearables that will give you essentially an analysis of your microbiome. It'll give you, your genetics in a very inexpensive way. You'll have your behavioral data. You'll get your blood work. So if you combine the microbiome, the genetics, the behavior, and the biometrics, like there's some pretty powerful things that a doctor and a consumer could do together to understand someone's potential to have a condition or to even manage a condition. So I think that consumers are going to become the CEO of their own health, and this data will be much more of a common standard, especially if something like the iWatch, the Apple iWatch, or the Samsung and Google, these companies are all developing new technology to enable consumers to have real-time information on their health.
Absolutely. I mean, the iWatch is something that's come up a lot, and I think other people expect that this is going to be sooner rather than later that we're going to see it. Sort of given what Apple's done with phones and music players and so forth, how much of a role do you think the iWatch will play in sort of bringing this to the sort of mass consciousness?
Well, if Apple does what they typically do, which is an amazing job integrating hardware, software, and services, I think it will be a device that is coveted and enjoyed by many. And if so, I think it'll become much more fun, comfortable, and standard to look at your heart rate and understand how many steps you walked and how well you slept. And I think these things will become much more common by consumers.
Seems like it might play into the healthy part of consumers' competitive instinct as well, right? Just
Absolutely.
who got the best sleep last night. That could be interesting. So let's talk a little bit about this this market for apps and wearables, because it seems like this is what will sort of maybe drive the initial goal. I think you wrote in your article that by 2017 you expect half of the 3.4 billion smartphone or tablet users worldwide will be using health apps. This is really in stark contrast to the history of medicine, where it's really been a very sort of patriarchal system. The doctor knows what's going on, you don't know what's going on, and that's the sort of the dynamic between doctor and patient. What are some thoughts you have about the development of the industry with these tools?
I mean, you're seeing the growth of health apps already today. I think it's one of the fastest growing categories, and Apple's even starting in their TV advertising to advertise the different health apps you can use on your iPhone, because I think Flurry released a mobile report earlier this year that said it was the fastest growing category. So it's becoming more mainstream. And then consumers are using this to track. And then when they go in to meet with a doctor, they generally have, they've either researched their condition or their questions on the web, and then they take all their data from their wearables or their devices and they share it. So I think it's already shifting. And if you think about it, just stepping back, I mean, the doctor visit really hasn't changed in like 80 years, right?
Yeah.
And it is a little bit archaic the way it's done, especially now that we will have all this data and the consumer will be able to know things real time, and so will the doctor. So I think that the consumer-doctor relationship will be pretty different in the next 5 to 10 years, and factoring in some of this, behavior data and regular biometric data that consumers are able to get. And even the ability to get that biometric data is going to the cost will go way down. So like Theranos, is working to get the cost of the blood work down so that you can get all of this blood work in one drip, very inexpensively at a Walgreens. So imagine the data that you will have on it. And, as a doctor, you'll have so much more data on someone as opposed to just looking at them and guesswork, right? And trying to diagnose what's going on with them.
Yeah, there's certainly a lot of guesswork now. And I think, measuring those upstream factors is going to be a complete game changer, and that's why part of the reason why I'm excited, to have this technological part on the Evolution of Medicine Summit, because I think it's going to be something that we're going to obviously see a lot more of. From the doctor's point of view, that sounds great. From the patient's point of view, that they'll have all of this extra data and they'll be empowered and so forth. I'm just thinking about for the doctor's point of view, where the doctor, first of all, is not used to having this sort of data coming directly from the patient, and then has to sort of relearn how to interpret that data in the context of, of the body. The doctor's role is really to take that data and sort of synthesize it. How do you see doctors, because medicine has been slow to adapt to pretty much anything. They say it takes 17 years for science to become mainstream practice. Do you see that there'll need to be some sort of acceleration of evolution for doctors, or do you think there'll be like a new class of medical technician that will be sort of interpreting all these different data from different apps and so forth before it sort of becomes standardized?
I'm not sure. I think it'll evolve very, very much. I think, first of all, I think it's a huge opportunity for doctors, right? Because imagine today, a typical doctor's day, they spend a lot of time inputting data into a computer, into an electronic medical record. They have to deal with billing issues. They're very busy. They only have 7 to 8 minutes for a patient. Now imagine if a lot of this was automated and there's nurse practitioners and other folks who can handle some of the work and take. We already have a shortage of doctors, primary care doctors in particular in the country. And so a lot of this can be simplified and automated, and then the doctor can actually focus on what they're really good at, and that is taking this really rich data and having a conversation with the consumer and really trying to help them. And so I think it'll fundamentally change for the better. It'll make doctors' lives easier, and I think it will be incremental. Like, you'll see lots of little different types of innovation, and then it will all come together. We always sort of underestimate the innovation, the time that it takes in the long run. It's usually shorter, but then in the short term, there's lots of fits and starts, and so you're going to see lots of fits and starts before it becomes more common.
Absolutely. And what do you have any advice for people in that fits and start stage where so you can sort of see the potential for it, but it's not quite realized yet?
Well, I think people will just buy, they will buy new devices, they will test them. Doctors will start using them themselves and start integrating them into their practice. And so, people will test and learn. I think that's the best way to do it, is just test and learn.
Yeah, just sort of iterating on that skill. Do you see potential issues in the fact that not a lot of the communications sort of talk to each other? I think we're already seeing in the sort of EMR world that there are, maybe this is an example of it, where it's going to take some sort of big organization with a lot of power and computing power to be able to help all of these EMR records talk to each other. And that's one of the things I hear from doctors, is they're sort of scared to, get set up with the wrong EMR in case they go out of business, or that computer system can't interface with the other systems. Is that part of the shakeout that you're talking about?
Well, I think that the communication matters, and it actually seems relatively straightforward if you just step back for a second and say, for example, I know someone in my family who had cancer and who was at UCSF but wanted to go down to Stanford, and they both use Epic, and neither system the Epic systems didn't talk to each other, and they had to retake all the tests, right, which is a huge hit to the system. It's a lot of money. So I think that's just natural that it's going to be solved, because it's just a ridiculous pain point. Everyone is recognizing it, and the systems should all talk to each other. Now we have cloud-based services that enable, HIPAA-compliant communication across companies. So It's going to happen. I don't know if it's a big company, candidly. In fact, if anything, maybe it's a startup that does it, because I think the issue with evolution in the healthcare system has been that it takes so long to get everyone behind such change that it takes too long. And so hopefully there are cloud-based mobile solutions that evolve that push the system to innovate. But I do think it will have to become one system in the cloud and with safe communication and sharing of data. But that will enable even better diagnosis, better research, better management of the patient.
Absolutely. And, we've been speaking about this sort of change of the doctor visit. I mean, one of the things that we're seeing already is that maybe this doctor visit is not in person. We've had this weekend in the medical part of the conference, Dr. Jeff Glad has built a really strong, sustainable, successful clinic in quite a rural zip code just by offering sort of telemedicine services. We're seeing a lot of different work. Dr. Mark Hyman's working on a program to be able to do sort of health coaching digitally and have people available. When you say the medical visit is going to look very different than it is now, are there certain pieces of that you feel that you could share with people who are listening so they can sort of prepare themselves?
I think we've seen that telemedicine works. Certainly, even outside of the U.S., it's helped across rural areas, different countries. It will become much more standard. I think something like I want to say 36 states in the U.S. allow for it, and for insurance reimbursement. And I think you'll see all states move that direction, and virtual care will become more standard. A lot of these visits, primary care visits, chronic care visits, are not really required in person. And so a lot of that will be transitioned to telemedicine.
Yeah, that's so outside of just sort of the long distance side of things, are there other ways that you see that process evolving?
I've studied marketplaces and I worked at eBay for nearly a decade. And so I step back and I think that technology and marketplaces will be applied to almost every area of healthcare. So, for example, there'll be a marketplace of providers and experts you can access. And even if in this country or globally, if you have a condition and it's probably through telemedicine, you'll be able to get access to those folks. And then I think marketplaces will be able to facilitate drug discovery and shared research in the cloud, and hopefully for cancer and complex issues. And then hopefully it'll drive price transparency. So, I don't think it's just in telemedicine. I think it's across the board.
You could see people engaging with specialists or other things in other countries, and I mean that's pretty amazing and exciting in itself.
Yeah, I mean, imagine if you were in a rural area in Africa you were trying to help a patient, you didn't have an answer to something, you could telemedicine with another doctor, or you could even better yet use Google Glass and perform surgery and have another doctor, cloud-based connect in and help you with the surgery. So, I mean, there's just a lot of different directions this could go.
Yeah, that's a whole area that I'd never even considered. Those sort of like live connections into the medical delivery is very interesting. Yeah, so it sounds like there's potential, for that sort of empowerment medicine as far as primary care and avoiding and preventing chronic disease. But it also seems now that there's potential for better acute care too.
Mm-hmm. Absolutely.
So, what about from the sort of venture capital perspective of all of this, Stephanie? Because that's sort of where you're sitting. When capital moves into a certain industry, and it has the effect of really amplifying the potential for what it can deliver. From a venture capital point of view, what are, because there are probably people listening to this thinking, I've got a great idea for an app, or I've got a great idea for a wearable or something that fits with something else. What are you guys sort of looking for when you're looking at, investing in these kind of technologies?
Well, I would say, first of all, the investment in digital health has really scaled. So Rock Health, which is an accelerator incubator out here, has written several, every year they do a study. I think it's every 6 months on the investment behind digital health. And it's grown, it's quadrupled in the last couple of years. So I think there's just a tremendous amount of excitement about the sector and investment. And I think it gets just my personal view is just that technology and marketplace models will disrupt, essentially nearly every area. So whether it be the sort of just diagnosis and treatment, whether it's drug discovery or pricing of insurance, price transparency, access to experts, those kinds of things will all be in a way affected. And I think with social and mobile, it changes, your connection with between the patient and the consumer, because it's real time, on demand, on your phone. You can reach someone anywhere in the world. So it's quite transformative, and I'm hoping that these solutions, the mobile and cloud in particular, have the potential to really change healthcare for the better.
Yeah, absolutely. And so, do you have any advice for people who are sort of looking to sort of be discovered, or to be able to sort of access this capital? How do you need to communicate the value of what you can provide to to groups such as the company you work for now?
Well, so I think there's a ton of opportunity, and people are raising seed funding now. It's much easier to raise seed funding, and you can use. There's also, of course, there's venture firms, but there's also a lot of angel investors. And so, if an entrepreneur has an idea, I think they should build a prototype and really start testing it and interview consumers and see, or doctors, and see what they can learn about their idea and get it as far as they can, and then they can go and try to raise some money.
It seems like it's sort of opening, that world is opening up to a lot of different people. Certainly people I see that have been in the field a long time who are interested in this and looking to innovate. I'm excited to see what's going to come, especially from, the industries that have been interested in preventative medicine for a long time. It's sort of becoming a cool trend now, but there are physicians and organizations that have been doing this for a long time, and I think that they have a certain insight into preventative medicine that maybe a sort of an entrepreneur wouldn't directly have, and I hope that they find ways to use that insight towards those sort of directions. I guess one thing we've seen in medicine is quite a patriarchal system. How doctors work out what to do. It's normally all taken from clinical trials, and then those clinical trials are synthesized down to journals, and then the journals go to the doctors, and the doctors then use that information, sort of like a top-down system. Do you see potential for more like sort of peer-to-peer experiential communication between doctors about what works and what doesn't work?
Absolutely. Imagine if you're working on heart condition or gestational diabetes or leukemia, any of these conditions, and you're able to communicate with another doctor and get you could actually share data in the cloud and compare notes right across a population, and then be able to, it's no longer guesswork, right? You're actually able to look across different treatments and different patients. And I think that there's already marketplaces evolving in that direction. And this notion of everything being so top down and regulated, I think will change. And you'll see sort of experiments in different areas, and then it'll become more standard and accepted by the government and the traditional research organizations.
That'll be quite a big thing for them to let go of, though, because that's a century at least of pretty tight control of what happens and what doesn't happen in medicine. Do you see some friction points in that?
I'm sure there'll be some friction. There's always friction with innovation.
Yeah, exactly. I guess that's sort of inevitable. And actually, what you see generally, if you take a step back and look any place where there's integration, and it's really integration happening at so many different levels in medicine and society, definitely, where there's friction of integration in all spots there. In the next generation here, moving forward, and with the next generation of sort of empowered consumer that now is in charge of their own data and is working that, how do people now in September 2014, what are some of the sort of your favorite tools that you've got out in the marketplace now that you feel are sort of are the ones that at this point feel like ones that are sort of leading the charge? if someone's getting into it from scratch, they just got their iPhone and they're ready to go, what are some of the best tools that you recommend or that you've seen people or other people around getting good results with?
Well, I think it really depends on your goals. I think today, if you want to learn just the basics of your health, there are wearables like the Fitbit. The Fitbit is the top selling wearable. I think they have like 70% market share. So you can go buy a Fitbit at any store. They sell them at Apple stores and learn about your steps, your sleep, get a better sense of your habits. Now, that being said, I do think this fall, I hope this fall, later this year, there's some new devices that are coming out that will actually go deeper than what the Fitbit does and actually measure heart rate variability, and maybe even glucose and other things like that. So I would suspect that the wearables will become more common and people will wear them, and Fitbit members who wear them consistently love them, and it's a game for them. Like they have to hit their 10,000 steps a day, and they compete with their spouses and their friends. So that's an easy recommendation. And then there's a ton of apps depending on what your goals are. If you want to lose weight, you can try MyFitnessPal, which is the leading calorie counter. If you have asthma, you can use Propeller to track. If you have diabetes, there's a lot of diabetes apps. If you're trying to get pregnant, you can try Glow. I mean, so it really depends on what your objective is.
Do you see more and more niching of like very, very specific things that people will go for, like different types of diseases?
Yeah, there's already so many different apps out there. So for anything, you can find an app.
Exactly. I mentioned earlier sort of the competitive instinct. I know, among my friends I've got a friend who has the Fitbit, and he's always trying to get people to play because he's, doing 100,000 steps a week, and, he wants more competition. He's always trying to get me involved to do it, although I'm not sure I could beat him on that, even though I do live in New York and walk around a lot. But you mentioned in your article sort of gamification and the creation of games. When I was at South by Southwest earlier this year, I saw an awesome app called, what was it called? It was the one where you have to bet on yourself essentially to do your food or your fitness goals, and you can actually make money by sticking to your goals. Seems like there's sort of almost unlimited sort of permutations and combinations of data and gamification and integration of life and world. I mean, it's pretty an exciting world to sort of get the competitive nature of the human spirit behind something that's so needed and valuable for our society right now.
Absolutely. There's tons of apps that can, that enable you to compete, and groups that do things together. And then, I think the app you're talking about was GymPact, where you pay $5 if you don't go to the gym, right? So, yeah. But I think what you're also going to see is that the growth, at least in the U.S., there's the growth of high deductible insurance, right? So 44% of employers are offering high deductible insurance, which, and they're offering incentives for employees to and gamification around good behavior and sharing their 10,000 steps a day and hitting their 10,000 steps a day. And so you'll see increasingly, I think, premiums slightly differentiated based on behavior.
Yeah, exactly. Could you see this rolling out into sort of the corporate world? Because you see companies like Safeway already that have really got ahead of the curve on preventative medicine, and they've been able to really realize significant.
Yeah, Safeway's claim that they've, over a period of 5 years, they saved 50% in their healthcare costs.
Yeah, that's amazing. I mean, to me, looking at the market now, it seems like if I was an investor at a company that had done none of this, had not done any wellness programs or those kind of things, I'd be looking at those healthcare costs and sort of demanding that they take this more seriously. I mean, if Safeway's been able to save 50%, some of the healthcare costs of some of these companies with hundreds of thousands of employees, it seems like this is a topic that could be front and center for upper management in these big companies.
Absolutely. I mean, it's a big cost driver, right? And it's a big opportunity. Everybody wants a healthy workforce because it improves productivity and overall quality of work and life.
Seems like a perfect, in the corporate environment, it seems like a perfect place for gamification as well, because there's always things like, competing between employees and so forth. That could be,
Absolutely.
I think that'd be the next thing. It's a very exciting world, and I really appreciate coming to share some of this. And I hope that the Evolution of Medicine brand, as we develop it and we do the podcast and the summits moving forward, one of the things about the name, the Evolution of Medicine, is that it can really look at all the different areas of evolution. But it seems like this one, sort of more than anything, is something that's going to be the most dynamic over the next few years. And looking at it, if we're doing this, this summit this time next year, what would be your best guess for things that we might be talking about then that we won't sort of have in our minds right now? Or is that proprietary information for your company?
Look, I think I'm hoping a year from now there's like a ton more startups that have innovated and either they've discovered a cure for cancer or well, certainly wearables would become more rampant, and maybe even somebody's used a wearable to prevent a heart attack, and a company like Proteus, for example, has done tracking of medication compliance. And I mean, the world is our oyster, right? There's just so much opportunity. I can only imagine how much more innovation is going to happen in the next year relative to the last year. And I think it'll be everywhere. It'll be in patient delivery, it'll be in drug discovery, it'll be in insurance, employer-based gamification models. I mean, you name it. I think there'll be a tremendous amount of change, wearables, etc.
And for people who this may have piqued their interest, where do you see as the best way to sort of keep up with what's going on and the new things and what's working and what's being uptaken? Because I'm sure that there's a lot of people who are in the preventative medicine industry or holistic or functional medicine who are sort of now realizing that this is a benevolent force as far as the goals of their industry. What's the best ways that you see to sort of keep up with these kind of trends?
Well, there's so many different people, blogs and publications you can follow. I have honed my Twitter feed so that I can follow people like Eric Topol and other luminaries in the space. So that's one way you can try to follow some of these folks. But there's just so many different articles, and there's also like Paul Sonner, I think it is, in Twitter, also, who has a following of like. He's created a health blog, and he has over 20,000 people who are writing in every day. So there's lots of different folks in Twitter that you can follow, and there's lots of health blogs and everything. I would just read as much as you can, and obviously talk to people like you.
Well, I'm glad to have people like you here to be able to help us all understand it and see how it works and understand the potential for it. It seems like it'll be another year along the journey next year, so there'll be a lot more of an understanding of it. I mean, just to go back to the iWatch for one thing, it seems like there's been other companies that have been thinking about creating hardware that have sort of been scared off from creating hardware because they know that the iWatch is coming, and the next battle will really be like sort of the software and the combination of the information that's coming from the iWatch. If you think about the iPhone, well, for the first time we had sort of a phone and geo-positioning and a camera all together, and so you see that the big apps were Instagram and Snapchat and those type of things. Seems like more and more people in the industry, or the sort of down low rumors, is that it's going to be a better place to be in the software game than the hardware, because someone like Apple can just come and take that same kind of market share that you've seen that Fitbit's got already.
Well, just like the introduction of the iPhone in 2007 and then the App Store shortly thereafter, I think you'll see a whole new set of products that emerge, software and services that emerge. I still think you'll see interesting hardware. So I think you'll see a lot of new hardware, software, and services combined. But hopefully somebody like Apple or Samsung or others will create enough critical mass that the software and services will have a platform on which to really build scale. So, I mean, the estimates for the first year of the iWatch are something like 63 million devices sold. So that's quite, that's scale in a very short order, similar to like an iPad kind of scale. So I think that will drive a lot of innovation.
That's amazing, and yeah, well, that's very exciting. And so, what I hear you saying is that it's definitely not too late. If you're listening to this and you've got an idea, it's just a question of getting your idea into a usable format. And it's because I spoke at a conference 2 years ago amongst pretty much an older crowd of doctors. I have to say, wasn't many young guns there on it, but this was 2 years ago. They were saying, well, I can't think that there'll be any more apps. There's too many apps already. And it seems like that may have been completely wrong. It's just going to keep moving forward. Stephanie, it's been such a pleasure to have you here, and I really appreciate you offering everything here. And I look forward to to following this very closely over the next few months and years. And definitely appreciate your thoughts. Throughout the summit, I've asked every single person that I've interviewed. When I say the words, the evolution of medicine, what does that really bring up for you?
I guess the future of medicine and how technology and in particular mobile and the cloud and social will change the way that we view the doctor-patient relationship and healthcare in general and how it's provided.
Well, I really appreciate you coming on to share with our audience here today. If people want to follow your work and get up to date with what you're doing, what's the best way to follow you for the people at home?
Just Twitter. My Twitter handle is Tilenius at Twitter. Stilenius at Twitter.
Thank you so much. So this has been the Evolution of Medicine Summit. This has been the Silicon Valley view on the evolution of medicine. Stephanie Tilenius has been with us. Thank you so much for your time. Definitely stay in touch for the rest of the summit. We'll have a lot more looks into all areas of the evolution of medicine, and particularly this weekend. If your doctor is not up to date with any of this and you feel like he needs sort of a helping hand, definitely have him tune in to Dr. Jeffrey Glad on Saturday, who's going to be talking about his journey thus far into telemedicine and some of the innovation that he's been able to do in his practice. It's going to take us all working together to be able to develop a strong, sustainable system, a medical system. And I really appreciate your thoughts on all of this, Stephanie. And we'll look forward to being in touch. And we'll see you next time.
Thank you.